channel, and as you all know by now, this is dedicated to the cause of community medicine, making it simpler, more understandable and applicable in the real field by one and all who goes through it. This particular video is a much requested video by my students appearing for their third part 1 MBBS community medicine practical examinations, and this is in line with the cbme requirements of the examination mode, that is Osce and Ospe. That is observed structured clinical examination and observed structured practical examination. So this Osce Ospe is a new entrant under the folds of cbme. So the practical which the community medicine has been going through for ages has gone for a big change. So in this particular video, I would suggest not just for the students but also for those institutions, those faculties going for Osce Ospe, it could prove to be a fallback material. Maybe some ideas could be incorporated from herein and be implemented. All are in experimental phase, to be honest, but in our institution we have tried to incorporate it in as pure form as possible. So let's go through it. But before that, if you're new to this channel, please subscribe to the channel. It doesn't cost you a penny, but it means a lot to me. And if you like the video, put the thumbs up and press the bell icon so that you keep tuned for all the nice and enriching academic contents that I keep uploading. Now back to the practical examination that the students are going to appear for. Well, you will be facing the grand viva in two parts. Since the university requires you to go for a 40 marks grand viva, most of the institutions are splitting into two. One that the students will face based on the tray, which usually contains the vaccines, the family planning devices, the things like vitamin A, ORS, the mother and child protection card, zinc tablets, the antitubercular drugs, and all those stuff. In fact, you will find a very elaborate video on this tray and epidenstat exercises, which I'll provide you in the description link as well, and you can go through it. And the other viva will be based on problem cards in our institute. So again, for the problem cards also I have videos, and please go through them. Coming to the family, there will be a scheduled family table and there is a family video as well. Make sure that you know your given family well. You're able to spell out the family diagnosis properly, and what are the medico-social problems, what were your recommendations, and what were your nutritional survey findings, which were the food items or nutrients deficient or excess, and how you recommended them to overcome that. Coming to the project, again I have emphasized earlier also, be sure to know the title of the project, the objective, the methodology, and of course the major findings of the result. Coming to epidenstat exercises, you have these in my videos, which the links will be given in the description box. Please do practice them well so that you can complete them within the given time frame. Now coming to the most requested part of Osce Ospe. So let's begin. So in our institute, what we plan to execute is going for a ATCOM or counseling part in the Ospe, which will have several cards from which the students will need to pick up one card, and one of the faculties will act as the client which the student needs to counsel. Apart from these are the various Ospe stations that we'll be having, and each of the station you will be given 3 minutes to carry out as per the direction given in that particular station. And as soon as the buzzer rings, you have to shift from the station to the next station. Each student will face any of the 3 stations as mentioned here. So let's take one. First, let's start with the ATCOM station or the counseling one. This is very important for you to know that if a particular card is picked up, like a mother comes to know whether if the breastfeeding is being inadequate or adequate for her child, don't jump right away into counseling in that regard. First and foremost, you must mention to the examiner that you will be adopting a gather approach while handling this client, and you'll be greeting them, asking them some open-ended questions, telling them the different scenario, helping them take an informed decision, and explain the client, and also along with tell him or her the expected return visit. And then we'll mention that I'll try to build a relation, I'll maintain eye contact with appropriate facial expression, I'll try to get the body movement cues and verbal prompts and easy to understand language. Now I will start the counseling. So you will now start talking, open the discussion in context of the given problem. Whatever is the given problem, you have to talk then in regard to that. You have to ask some confident, open-ended questions concentrating on the client. Here we adopt the Kalamazoo approach, where this is a particular approach used for patient and physician communication. So this Kalamazoo approach, what you do that after all these, you try to build a relation with the patient, making him or her comfortable, gather information from him or her, then share the information that is relevant to her, come to an agreement, and once you come to an agreement that she or he is also agreeable to what you are suggesting, and once that agreement is reached, you make a closure of the same. So these are the basic steps of counseling that you need to mention. If you don't remember all these, just remember 2 things. That ma'am or sir, we will be going for the gather approach, that is greet, ask, tell, help, explain and mention the return visit. And then according to the Kalamazoo approach of patient-physician communication, will build a relationship and gather the information required and share the information and then reach agreement and closure. Now I will start the discussion, and you start asking questions after greeting the client concerned, which will usually be role played by some of the faculties. Now there may be various counseling cards, like my 6-month child presently on breastfeeding. We are not using any contraception. My friend says I won't conceive till I breastfeed my child. So this, if the client says you need to inquire, about her present status, her equation with her husband. If her husband is cooperative, then explain her that it is not giving you a complete protection and one needs to take some contraceptive measures. And according to the need, suggest her through a cafeteria of choice whatever is applicable in this particular scenario. And once she agrees, reach an agreement, make a closure and ask her for coming for a follow-up. Next is, I am not having enough breast milk to feed my child. My child is 3 months old. Should I start on bottle feeding? Here again, after greeting, initiating the conversation, the points that you need to build on are that making her understand when a child, you can say, is having sufficient nutrition from breast milk. That is passage of 6 to 8 times urine in a day, 1 or 2 times motion in a day, and the gain of weight of the child is adequate. Now coming to the third one, my 3-month child is suffering from mild fever, running nose and vomiting. He is often crying and not playful. I found him having problem in breathing and sucking breast. Of course, you can understand from the scenario that you will have to build the child in line of the integrated management of neonatal and childhood illness in that lineup and convince the mother accordingly. Then there could be problems like my 10-month-old child developed yellowish spots on the white part of the right eye. Of course, now you know it that this is nothing but is being talked about is the Bitot spot. So you have to stress upon the role of vitamin A prophylaxis program, going for the vitamin A prophylaxis in the nearby centers, as well as incorporating lots of greens in the food because the child has already crossed the exclusive breastfeeding period. I have not given any immunization to my 3-month-old child till today. So this is the card where you will have to deal according to the case of missed immunization and how to deal it. My 6-month-old child having loose motion since yesterday is passing 6 to 8 times stools per day. He is not vomiting and taking breast milk. He has mild fever. Again, you have to manage this and counsel the mother according to the IMNCI guidelines. But in all these, the standing and instruction remains mention of the incorporating the gather approach and using the Kalamazoo approach, the patient-physician communication method. Now coming to the different stations. You may have a station of baby feeding bottle where you may be asked to identify the item, ask what is its purpose and mention the disadvantages. Yes, it's nothing but a baby feeding bottle and its purpose is artificial feeding of milk. Now, what are the disadvantages? There will be more probability of diarrhea, ARI and other infections. These are not easily digestible, lacks the balance of nutrient, and there could be cases of milk intolerance and allergy, increased risk of some chronic diseases, overweight babies, and the mother has increased risk of anemia, ovarian and breast cancer, osteoporosis, according to some school of thoughts. Now let's come to this. You may be given a model like this with speckled rashes all over and asked to identify the disease. How does the wave of rash appear in this disease? And mention its preventive measures. So this is nothing but a model of measles. but be sure that name measles will not be visible. It will be, of course, blocked. Rash begins behind the ears, spreads rapidly over face and neck and extends down the body, taking around 2 to 3 days to progress to other extremities. Initially, this rash is discrete, then it slowly becomes confluent and blotchy. Now coming to the prevention, of course, measles vaccination, which the coverage should be ideally 95%, and along with it, administration of immunoglobulins. Now this is an interesting station, because in this station, more than writing, your time will be spent in putting it in action. So identify the instrument. This is the SALTER'S weighing scale. What are the advantages of using this instrument over a weighing scale? This is convenient to carry and easy to use at the community level. So mention the steps of weighing a child with this instrument. Along with the steps, more important is you carrying it out in the practicals. There will be a suspending point from which you need to hang that dial. The lower hook, that is the point from where you will hang the baby put inside this cloth bag. The two legs of the baby will go through those leg holes of the bag, and you have to hang the child from that SALTER'S scale and read the scale at eye level and write down the weight. Particularly in this station, be sure to focus completely. The next, there is the baby weighing scale. You will be asked to identify the instrument, which is a baby weighing scale. You have to measure the weight of the newborn with this instrument and interpret your findings. You will be given a toy baby and asked to weigh it. So what you have to first do, you have to first calibrate it and adjust the zero, and then carefully place the baby and then interpret and put down the weight. And if it is less than 2.5 kg, you have to interpret it as a case of low birth weight baby. Then there may be a station containing a bottle of salt and a bottle of oil. And you may be asked to mention at least 2 diseases caused due to excess intake of these food items. Of course, you can mention cardiovascular diseases and hypertension. You may be asked to mention the recommended dietary allowances or RDA of each of these food items. Name the type of diet which can help in regulating the intake of these food items. Well, of course, the RDA is for salt less than 5 grams per day, and for the oil it should be 20% of the total calorie. So in case of a sedentary male of a consumption of 2110 calories, it will work out to 422 calories. And since each gram of oil gives 9 calories, it will be 47 grams, of which 50% will be visible fat, this 23.5, and making it approx to 25 gram. So the requirement will be 5 spoons per person per day. And the diet is DASH diet. Now another nutritional station. In fact, nutrition has been a favorite while doing this Ospe stations, because there's a lot of things you need to know and apply in the practicals. So this will be on the supplementary action of protein, and you will be given a container of rice and dal. Of course, not the cooked version as shown in the picture. I was short of the picture, hence had to do with it. So kindly excuse that. The question will read, identify the food class. What are the limiting amino acid of these food, and how do these food complement each other in terms of amino acid availability. These are the cereals and the legumes. And here rice is deficient in lysine and threonine but rich in methionine, while pulse is deficient in methionine and rich in lysine and threonine. And both eaten together, they are biologically complete food. And this is known as the supplementary action of protein, whereby two vegetable food sources combine together and make a superior protein source. Now coming to another model like that of measles, but this one is of a different one. Here the question might read, identify the disease condition. What are its signs and symptoms? Deficiency of which nutritional component causes this disease? Well, you can understand from the pot belly, edematous body parts, and the apathetic facial expression. It is a case of kwashiorkor and caused due to protein deficiency. So the child may have, as I mentioned, irritable apathetic faces, edema plus, poor appetite, and flaky dermatosis in some cases. Now this one's a favorite with us, the food pyramid. Well, we got this done while celebrating the National Nutrition Week last year. So here the one in the yellow is the actual food pyramid which will be shown to you, and the one in the right is the guideline according to which you have to put these food items. The food items as shown in the picture will be all available just beside the pyramid in a tray. You have to organize the sparingly used, that's fats, oils, sweets, in the top of the pyramid. Things like milk, yogurt, fish, meat, nuts, those are in the one next to the top one. Then in the third one you will have the fruits and vegetables, and in the last one bread, cereals, pasta, rice, all those kind. Again, be careful, there will be a stipulated 3-minute time within which you have to organize this. This kind of a leonine faces model will be there, and you will be asked to identify the disease, what are the treatment regime and the causative agent. This is nothing but the leonine faces of lepromatous leprosy, and you will have to mention that this is the disease concern is lepromatous leprosy, or rather multibacillary leprosy, and the causative agent of course is Mycobacterium tuberculosis, and the treatment is according to the UMDT, that is the uniform multi-drug therapy, where you follow 3-drug regime for 12 months. That is rifampicin 600 mg once a month, clofazimine 300 mg once a month, and 50 mg daily, Dapsone 100 mg once daily. That is basically 12 blister packs of 28 days. So basically this was an idea for all of you going for Ospe in your institutions, as well as for my students to take it like a pro and nail it. All the very best for your examination. Hope this helps. And I really sorry for giving it so late, since I was very preoccupied. And if you do like the video, please give it a thumbs up, share your comments, share with all your friends from your college and other colleges who may benefit from this. And if you still haven't subscribed, please do subscribe and press the bell icon. Thank you so much for your patient hearing. All the very best.